Welcome back to Birching the West. I'm your host, Eldon Stahl, and we're talking about all things freedom related with the things with the John Birch Society and things that their members are interested in. And today we've got a very special guest, Kristen Chevrier. I think it's Chevrier. Okay.
Yep, you were very close.
Didn't want to.
Almost there.
I whatever language that is, I didn't want to butcher it, but I appreciate your being forgiving. Kristen is is it the president or chair? How do they call you?
Director. We just call it director. Yeah.
Of Your Health Freedom in Utah. And of course, there's other people that probably in other states want to know about it as well. But we're here to talk a little bit about an upcoming symposium in, I guess, Layton. Is that right?
Mm-hmm. Yep.
Yeah. What's going on in Layton that people might want to know about?
I think they will want to know about this. And I told Eldon before we started, this is a little bit unconventional the way, I usually am a little more giving a presentation, but we're doing a packet stuffing party in just a few minutes at my house. So if you are anywhere near Layton, Utah, like within hours, you probably want to come and see this symposium. So we have Dr. Peter McCullough. Hang on just 1 second here. I can hear you out here, guys. Sorry. There was some confusion about the fact that there's no wall in our living room. Okay, so yep. We have a symposium. We have done this symposium for 6 years. This is our 6th annual symposium. And we fly in speakers from around the country to come and speak about health issues, health freedom, and health and freedom. So all of those issues are addressed at this conference. And this year we are flying in Dr. Peter McCullough. I don't know if your listeners are familiar with him, but he is the expert on COVID in the nation. He has written more papers than anyone else and had them published. He's got peer-reviewed papers on the subject, and he knows his stuff. So he is coming in to speak to us, and we were lucky that we got him before the whole world wanted him. And now he's getting thousands of emails every day from people, and he's just booked solid. So he and his colleagues have done a lot of work on early intervention, including ivermectin and budesonide and zinc and vitamin C and all of the different things. And his experience is that you don't just use one treatment. If somebody is not responding to one treatment, then you try another treatment. And what we're seeing in the hospitals right now is that they're using maybe remdesivir, which can shut down your organs within 5 days. And they're also using intubation, which it does major traumatic injury to your lungs. And it's really hard to recover from intubation. So you only do that, according to my nursing friends, as a last resort. You don't rush people into the hospital and then stuff tubes down their lungs. So those two things are injuring and killing people. And we need to start having people looking at the early interventions so that we can save lives. And these doctors who are using these interventions are saving lives. They're having huge success. So that's Dr. Peter McCullough, and we're so grateful to have him coming. He's an amazing resource, and I want as many people to come as possible because I want them to be able to hear and absorb what it is he has to share. So we also have Dr. Larry Polewski, who is a holistic and integrative pediatrician from New York City. And he is also amazing. He's got a long list of qualifications and does a really good job of helping people to have whole health as opposed to just the allopathic approach to everything. Dr. Shannon Croner is from California, and she is amazing too. Were you going to say something, Eldon? Do you know her?
No,
Yes.
I've heard of the Dr. Is it
Pavlovsky.
Palevsky?
Not
No,
Pavlovsky.
yeah, it's probably Polish, so it's kind of hard for English
Yeah.
speakers to pronounce. But yeah, sounds like quite a brave individual, courageous person.
Yes. Yes. And then Dr. Shannon Croner is actually a clinical psychologist, but she's coming to speak to us about religious exemptions because she started a nonprofit. It's FOR.US, and freedom of religion. And then I guess US, United States, freedom of religion. So it's FOR.US. Anyway, she started this group and she's gone across the country for the last year and a half, 2 years, collecting religious leaders from all over the country. She's got a big group of high-powered religious, but in any case, she has a big group, and she has on her website forms for all different kinds of religious exemptions. So you can, if you are a medical professional, or if you're a student, or if you work in food services or whatever, she has a whole list of different kind of pre-written forms. I know there's a word for that, and it's escaping me at the moment, but yeah, whatever it is.
For
Anyway.
legal issues, is that kind of?
Yeah. So she's coming to speak about that. We have Dr. Jim Meehan, who is a physician and fitness advocate, martial artist, who is coming, and he's going to be speaking about corruption in the medical system. And he'll be able to shine a pretty good light on that, I think. And he's amazing. I love listening to him speak because he's a medical professional, and he's very proficient at what he does, but he also talks kind of like a Baptist preacher. And I love the combination. It's a great combination. It's very fun to listen to, and he's very knowledgeable. So then we have Dr. Paul Thomas, who is a pediatrician from Oregon, and he did vaccinated versus unvaccinated study. Well, he did a vaccinated versus unvaccinated study in his practice in Oregon, where he has 10,000 children in his practice. And he's going to be talking about the findings of his study, which actually lost him his medical license briefly. He now has his license back, but he's on probation, and he's not allowed to talk to his patients about vaccines. And this is just because he did the research and he was honest about the results. And that's what happens when people do that. Until when we have a tidal wave of these people coming forward, maybe we can turn this around. But right now they can pick them off individually. So that's Dr. Paul Thomas. He's the author of the Vaccine Friendly Plan. Then we have several other people coming to talk about various issues. This is all happening on Saturday, the 11th. September 11th. Sorry, I had low power mode there. I've been on the phone all day. So all these people are coming, and you can hear all of them. It's not where you have to choose one or the other. You come and you listen to all of them consecutively, and lunch is included in the ticket price. The tickets are $39 or $49. And I think I'm pretty sure the Labor Day discount is still in effect. So you could still get them probably for $39 if you go in and do the Labor Day. It's Labor Day, all one word, uppercase L, and then everything else is lowercase. So try that. If not, maybe I can give Eldon a different code to use that might still be working. So then the tickets would be $39, and you're getting an all-day event with these great doctors who are coming to share their message incidentally without being paid. They're not coming because we're paying them to come. We're paying for their airfare. We're paying for their hotel accommodations, transportation, all of that. But they have not asked for anything in return.
Mm.
They just are grateful for the opportunity to come and share their knowledge, and they're wanted all over the country. So
Right.
I would definitely take advantage of this opportunity. The other thing I wanted to mention really fast, if you don't mind if I shift gears. Oh, yourhealthfreedom.org. That's where you get the tickets. That's an important detail. Your Health Freedom, all one word, yourhealthfreedom.org is where you get tickets. And the event is in Layton. And I think I'm just going to be brave here and say it on the, no, should I say the location? I'm trying to decide. I've been telling people the location when they buy tickets.
Just
So
sharing the screen here.
yeah, there you go.
There you go.
So you get your tickets. So the symposium is already sold out, and we're grateful for that. We're sad for the people who wanted to come, but
Or the gala is
everybody
sold
who,
out, looks like.
I mean, yeah, excuse me. Oh my gosh. No, the symposium is not sold out. We have sold 370 some tickets, but we have lots of room. So please come to the symposium. The gala is sold out. So yourhealthfreedom.org. And then really quickly, I just wanted to mention that we are running a bill in Utah to make it so that businesses are not forced to be the enforcement arm of medical mandates or for medical mandates. So we have a form that you can fill out. I might still be able to put it in the chat, or is it there? Can you see it in the chat?
Let's take a look here.
Okay, I just put it in again. So if you are a business owner, we need you to help support this legislation. We've been told, okay. We've been told by the legislators that the businesses don't want this kind of legislation. And my feeling is that most business owners are not wanting to have to keep track of the health of their employees and their customers and report back to the government. I think that most business owners want to do business, and they want to be left alone by the government to do that business. So if you feel the same way, you can go to this website he's showing you right now. You can read our declaration and see if you agree. And if you agree, then will you please, as a business owner, sign up yourself and your business as supporting this legislation. We have a hearing on September 15th. We have a priority bill file, and we have a sponsor. It's Senator Mike Kennedy. And so we're ready to roll. We're ready for the hearing. What we need most is for businesses to come on board and to stay on board throughout the process, because it starts in September, on September 15th, but then it goes all the way through the legislative session in January, February, and the beginning of March. So if you are in Utah, I should have specified that. If you are in Utah and you are a business owner, please sign up to help us with this. And we would just greatly appreciate having you on board. Don't sign it if you're from another state, okay?
So
that would not be helpful.
For the hearing, would it be helpful if people show up to be part of that, or okay?
So it wouldn't. We don't need anybody to speak. We don't need anyone to speak.
Lined up, but
yes, and we need to have the most compelling speakers speak. So we've got that all set up already. But what we do need is for people to come to the hearing. And when we ask, are you here as a business owner in support of this bill, raise your hand and say, yes, I am here supporting this bill.
And do you have any details if they did want to show up in Salt Lake at the Capitol on that, or?
Yeah, actually, if you want to come to the Capitol, I would recommend parking on the east side parking lot of the Capitol. You can park all along the side of the sidewalk there, and then there's some parking along the edge of the ravine. There's parking all along the street, and then there are also parking lots there. And then I would come in. There's a courtyard behind the Capitol. so you can see the state capitol from the front, but if you're at the back of the state capitol, looking into the courtyard, the House building is on your left. It's on the left of the fountain, and you'll come in the front doors and walk straight in, and there will be stairs to the right, and you'll walk around those stairs and then turn directly to the left, and it's in House room 30 at 8:30 a.m. And we're just asking everyone to be very polite and respectful, and to dress nicely, respectfully, and to come and be there. And then when we ask for support, raise your hand. If you have a compelling story, or you have a large business, or you have, like, if you have a story where your business was destroyed by COVID policies, then please contact me and let me know that, so that we know to either use your story at this point or later on in other hearings. That would be very helpful. So my email address is Kristen, Kristen, at yourhealthfreedom.org. And you can contact me there if you have a story that you believe would be compelling to the legislators, to help them understand why it's important for businesses not to be burdened with mandating the health choices of employees and customers.
Yeah, that sounds like a definitely a good plan. And so 8:30 on, I think is that a Wednesday? I think.
I think it's the Tuesday. It's the 15th,
Tuesday?
September 15th, 8:30
Okay.
a.m. in House Room 30. So,
Okay.
And then again, the symposium is Saturday, and we would love to see you there. The sooner you order the tickets, the better, because we're trying to get a lunch count to them by tomorrow. So if you order the tickets quickly, that will help us to know. Lunch is included in the ticket price. So we would appreciate that immensely. And thank you for having me on to talk about it.
Oh, well, glad you could be on. It's I know our watchers or listeners are going to want to also see the recording or
Yes,
listen
and
to
we
it.
are recording.
Yep.
Fingers crossed that everything works out right with the recording, right?
Yeah. We just send out the link,
I know.
and people are able to do that. And we've had a good amount of interest in this event, because as you know, we went through quite a bit of difficulties over the last 18 months with government gone wild, trying to use, I guess what I would say is a relatively minor risk, and use that as an opportunity to grow government.
Yeah. That is for sure. That's been happening, and we need to stop it. That's our job. And I think if enough of us get together, we can do that. I think the problem is that so often we're fractured, or we're separated by little differences from another group that's very similar. And so we just don't work together. But I think in this particular situation, if we don't work together, we're done. So we need to get together now and start helping each other.
Yeah, definitely. This is something that all people that value their freedoms, their liberties, this is something that's you can't really ignore. You got to be involved.
Yeah.
Got to get involved.
Absolutely. Thank you so much for having me on. I'm going to jump off because I've got people coming over to stuff packets. So thank you very much, and I'll see you on Saturday.
All right. Thank you so much, and
All right.
we'll see you then. Thanks.
Okay, thanks.